Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you the update for cases, which includes a total of 488 cases reported over the week of January the 3rd to the 9th. We have also had some deaths over the last week. I regret to inform you about 3 people who passed away. They are a man between the ages of 65 and 79, a man between the ages of 65 and 79, and a woman in her 80s, all of them living in Simcoe County. And I would like to express my condolences to the family members for your loss. If we look over the past week, we find that from the week that began on the 3rd of January, sorry, I can hear some background noise. If everybody can make sure that their line is muted, that would be great. Thank you very much. If we look at the week of January the 3rd, we had 487 cases, which is up considerably compared with the previous week at 405, which is up substantially from the week before at 345. So that's very much an ongoing steep increase in our case count and in our weekly rate of cases. So if we look at the cases that we've had just since yesterday, so far this week, it's a total of 61. And they range in age from under 10 to in their 80s, with 4 of them living in Muskoka and the rest living in Simcoe County. So at this point in time, we have 1,277 active cases, which is up basically a doubling from the week of December the 22nd. And we have a total of 2,529 recovered cases. At this point in time, we have 35 cases in the hospital, up from 26, and their ages range from 20s to their 90s. All of them live in Simcoe County, and 3 of them are in the intensive care unit. These are, by the way, cases hospitalized who live here. They're actually located in Simcoe County, some of them elsewhere in the province in terms of where they're receiving their care. But we have other individuals who are being provided care here at hospitals, and our hospitals, both RVH and Soldiers Memorial Hospital, are both receiving patients for care from the Greater Toronto area in order to help support them, because they have so many cases in hospital right now in that part of the province. So currently we have 24 outbreaks, up from 20 in the past week, and 13 are in institutions, long-term care facilities, and retirement homes. 5 of them are in congregate settings in group homes, and 5 of them are in workplaces. So various businesses and services in Simcoe County, with 1 in the district of Muskoka. We have no schools in outbreaks since they are closed, but we have we had 2 outbreaks in child care centers which have been declared over. And we have 1 outbreak in a food and beverage location in Simcoe County. If we look at the incidence of cases from January 3rd, this is the first week in which had more than 80 cases per 100,000 population per week. And so that's very high. That's up from 60, which was what it had been a week ago. and not quite at the 100 level where the province had been, from what we've seen, declaring areas to be in lockdown in the gray zone with the old framework that they were applying before they put in place the shutdown, and before today the declaration of an emergency and the stay-at-home order that's now in place. But still, 80 cases per 100,000 is very high, and noting that it's gone up rapidly from the previous week, that's certainly cause for great concern. And if we look within Simcoe, Muskoka, the concentration of cases is greatest in the south, and in particular in Bradford, West Gwillimbury, where they have an incidence of 228 cases per 100,000 population per week. So that is very high. And that's up from the previous week of 150 cases per 100,000 population. And that's 4 weeks in Bradford, West Gwillimbury, in which they've been above 100 cases per 100,000 population per week. So very high. That community in particular is experiencing a very high incidence of cases. Also, I would say that the community of New Tecumseh Township is also above 100 cases per 100,000 per week at 154 cases per 100,000 per week right now. So that too is very high. In the midst of all of this very disturbing news, we do have the light at the end of the tunnel, and that is immunization or vaccination. And since the 22nd of December, we have been providing immunization in partnership with RVH and the City of Barrie at their clinic at 29 Sperling Drive, and have been among actually the second highest provider of vaccinations since immunization began in the province, compared with the other sites that are providing vaccination in the province. So doing very, very well. And I would really like to commend the partnership that we're in to be able to achieve that. And also have some very good news today in that we yesterday launched a pilot to take vaccination to our long-term care facilities. So we went to 2 facilities, Oak Terrace in Aurelia and Victoria Village in Barrie, and between those 2 facilities immunized 178 residents. So this was a health unit staff in teams doing this with support from RVH with regards to the handling of the vaccine. We had support from their pharmacy personnel to be able to do that well, and a lot of support from the facilities themselves, the staff themselves at these facilities. So this is a success. And because of that success, and because we continue to have vaccine from the province, we're able to now, through this week, go to all of the other long-term care facilities and provide them, their residents, with immunization. This is really critical because this is the population that is at greatest risk of outbreaks and serious illness and death. And so by vaccinating these people, we're going a long way to reducing death from COVID-19 in Simcoe, Muskoka. So we intend to have that done by Saturday. And then we intend next week to proceed to the retirement homes and to vaccinate their residents as well through the course of the week. And they too are at a high risk. We've provided at the clinic in Barrie at 29 Sperling Drive, we provided immunization to the staff of these facilities, to the staff of long-term care facilities, and to the essential caregivers who provide care, family members who provide care to the residents of these long-term care facilities. So over 8,000 people have been immunized so far at that clinic. Healthcare workers who work in these facilities and work in hospitals, and that too will go a long way to protecting these facilities. Just over half of the staff of these facilities now have been immunized at that site, and we want to continue to provide immunization as supply allows, and over time to be able to protect those staff as well. And by protecting those staff, you protect the services that they provide, and you protect the patients that they care for and their residents that they care for. So with regards to our dashboard on our website, the dashboard that we created for ourselves, different from the province's framework, we remain in red status, so that is unchanged, and that's because of the degree of viral spread that is increasing and the numbers of outbreaks that have been happening. Also because of laboratory testing, we continue to have a fairly low turnaround time in the laboratory testing within 1 to 2 days. It's below target. Our health system capacity remains at yellow status with a bed occupancy and ICU ventilator occupancy that is about the same as what it has been, and has so far to date not been overly taxed by admissions for COVID-19 in our district, although I do note that we have some that have been transferred here from the GTA. And in terms of public health capacity, we remain in red status because we're struggling to keep up with the case count and to follow up with the cases, and have not been able to reach them within 24 hours. The majority we cannot reach it within 24 hours, so we remain in that red status. We've asked the majority of those cases to contact their contacts for us using our script that we have on our website in order to inform them that they need to be in isolation and seek testing. So we look at our trajectory data from January the 3rd to the 9th, our incidence at 68 cases per 100,000 population, which is up from the previous week at 58 per 100,000. And to be compared with Ontario, which is 135.4 per 100,000, and last week 106.6 per 100,000. So we're going up rapidly. The province is also going up rapidly. The province is higher than we are because of the very high case counts that are occurring in the GTA to the south of us. Our reproduction number is 1.3, which is up from 1.0. So anything above 1 means that there's growth happening. It's not coming under control. And our doubling time has shrunk, which speaks to rapid growth. So our doubling time now is 43.7 days. And with that doubling time, you would expect to see 7,500 cases in Simcoe, Muskoka by February the 15th. So our daily growth rate is 1.8%. So if this were to keep up, then we would have approximately 750 cases during the week of January the 31st to February the 6th, or around 107 cases per day, which would equal a rate of 125 cases per 100,000 population per week. So above that level of 100 that I talk about with, and what we've seen with the old framework designating lockdown gray status. So all of this really drives home the critical importance of people really taking to heart the control measures that I'm always speaking to, the importance of physical distancing for people who are not in your household, maintaining 2 meters distance from them, not having people over. We now have a stay-at-home order and a declaration of an emergency. I need to look at the details, because that's just been announced, but I need to look at the details as to what exactly that means and what is exactly in the regulations that we will need to enforce and that people will need to abide by. So that is certainly a task for me, for all of us to understand that. But I'm sure that what would be at the heart of it is that we shouldn't be going out unless we have an essential purpose, such as shopping or attending work or seeking medical attention or buying pharmaceuticals, medications. I'm hopeful that it also includes provision for people to get out for exercise. That's the kind of thing that I've always advocated for, but I need to see what's actually included in that requirement. So in terms of the outbreaks, one thing I would note is I'm very happy to say that the outbreak at Georgian Bay General Hospital has now been declared over. That is a good thing. I'm just having a double check on that. Okay. Actually, I want to look into one detail about that and get back to all of you about the details on that. So I'm just putting a hold on that for the moment. We've got Trillium Manor located in Aurelia with an outbreak that was declared on December the 14th. And the number of staff cases has increased. It's up to 19 from 13 a week ago, and the number of resident cases is 9, up from 8 a week ago. We've got Rivera Serra Vista in Elmvale, which has 1 resident case and 1 staff case, up from 2. And Georgian Manor in Penetanguishene with an outbreak declared on December the 27th with 3 staff cases, which is unchanged from a week ago, and 3 resident cases, up from 2 a week ago. Tiffin Retirement Residence in Midland with an outbreak declared on December the 27th, which has 1 positive staff case, which is unchanged. Lakeside Retirement Residence in Innisfil, which has 2 positive staff cases, which is unchanged. Woods Park Care Center in Barrie with 1 staff case, which is unchanged. Villa Retirement Lodge in Midland with 2 staff cases, which is up from 1 a week ago, and 2 resident cases, up by 1 from a week ago. Simcoe Manor in Beaton has 2 staff cases. Grove Park, 2 cases, up from 1 a week ago. The Pines in Bracebridge, 1 staff case. And Roberta Place, long-term care facility in Barrie, an outbreak declared on January the 8th, which is very big. It's rapidly progressed, very unfortunately. And so they have 40 resident cases and 2 positive staff cases. 1 resident who passed away. So this is a very concerning situation. We're working closely with this facility to see what they need in the way of support in order to manage the situation, but given how rapidly it's progressed and its size, it is a worrying situation. And an outbreak at Royal Victoria Hospital, Royal Victoria Regional Health Centre, declared on January the 9th with 7 positive patient cases and 3 positive staff cases, with investigations ongoing, management of the unit that's involved in order to test and isolate those that are required to be isolated. So we work closely with RVH in the management of that situation. And then Waypoint Care for Mental Health in Penetanguishene, outbreak declared on January the 9th. And that consists of 2 patient cases and 1 staff case. And testing of those on the affected areas has taken place. We await results. If we look at our congregate settings, we've got a group home in Simcoe County that has 9 staff cases, up from 7 a week ago, plus a temporary staff member who's a case, and 3 positive cases among residents, up from 1 a week ago. We have a group home in Simcoe County, which has 3 positive staff cases. That's unchanged from a week ago, and 1 positive resident case. We have a facility, a care facility in Muskoka, that a congregate setting that has 3 staff cases and 1 resident case. And we have another care facility in Muskoka with 1 resident case and test results are otherwise negative. And a shelter in Simcoe County with 1 positive staff case and testing otherwise being conducted at the site. We have in the for community outbreaks a food and beverage agency business in Simcoe County that had an outbreak declared on December 31st with 5 individuals involved, 5 positive test results. Okay. We have an outbreak at a emergency services location in Simcoe County with 8 positive cases and testing taking place there, and a business in Simcoe County with 4 positive cases and otherwise testing being conducted on all the other employees working at that location, and no members of the public exposed. And we have another business in Simcoe County declared on January the 8th with 3 staff, and another business in Muskoka declared on January the 11th with 7 staff cases and others being tested. So that is all of the outbreaks. In terms of my media messaging, I've already spoken to immunization and how important it is. The success that we've had to date, the fact that we're one of the leading locations in providing vaccination, certainly using up all the vaccine that we receive. We get it in regular installments. We have been administering it and then using what follows in the way of vaccines. So certainly been keeping up with the supply. So at this point, we've had a total of, I said over 8,000, but it's actually over 8,100 doses of vaccine administered to priority groups in Simcoe, Muskoka. And certainly we've had a lot of inquiry about groups that would be next to receive immunization. There's a lot of interest among healthcare providers who are not in those facilities that I've discussed, that work in other facilities in the community, that are very interested in immunization. And there's certainly been a lot of questions about whether paramedics should be immunized. In my opinion, those are all high priority groups to receive immunization, and we are planning to be able to provide them with immunization once we have enough of it, and once we've finished with protecting the residents and the staff of the long-term care facilities and the retirement homes, and ensuring that there's vaccine for other healthcare workers in hospitals as well who would want it. So we have to work with the supply we have and work through those groups. We have every intention of moving on and then protecting other groups as well. And through the course of time, as the vaccine becomes more and more plentiful, we will broaden out the provision of vaccine eventually to the entire community, working with other partners to be able to deliver it. So we do have planning process in place to be ready to provide that kind of immunization. We've got a committee coming together, an advisory committee this week with representation from the Indigenous community and from primary care and community pharmacies, long-term care, emergency medical services, paramedic services, and also our planning organizations such as the Central Region of Ontario Health. So we're having that group come together in order to help us craft the big plan for how we'll do this over the weeks and months to come, to be able to work with those groups as the vaccine becomes more plentiful, to be able to administer it broadly to the public. So the province's intention is that everybody who's eligible for a vaccine, who would want a vaccine, would have received it by August. And we have every intention of working with that timeline and the supply that we get to achieve that goal. As I said, I've said before, this is the way in which we will gain control of this pandemic. Right now we have tremendous growth, unfortunately, tragically, of cases, and the province needs to do what it has to do with a stay-at-home order and the other measures they're putting in place to help bring it under control. And all of us need to do our part to be part of the solution and abide by the control measures that we've been asking of everybody and, when necessary, requiring of everybody. But in the end, the vaccine is going to be absolutely critical to be able to bring this under control and allow us healthier, safer, more normal lives to come. We've done all that we can to make sure that we don't waste any of the vaccine, and strive to have a very, very low wastage rate. We have also managed to stretch that resource by getting 6 doses out of each vial instead of 5. So the manufacturer guarantees that you can get 5 doses, but we and other health units in the province, other hospitals in the province have found that if you're careful, you can get a 6th dose out of each vial. And so that increases your coverage by another 15%, which is excellent. And so we're certainly striving to achieve that, and in most cases we're able to achieve that.